Welcome back. I'm Bronwyn Newman. I'm a credentialed diabetes educator and the director of SHG. In today's episode, we're stepping into an important transition point. What happens after gestational diabetes? For many women, it isn't about just pregnancy anymore. It becomes about what comes next. Reducing future risk, protecting long-term health, and also learning how to grow alongside a young family whilst carrying that experience with you. After GDM, what are we actually talking about? Gestational diabetes is often the first time women are introduced to blood glucose monitoring, nutrition planning, and medical conversations about insulin sensitivity and risk. Once pregnancy is over, it can feel like everything suddenly stops, but the story doesn't end there. After GDM, there are usually 3 pathways people move into. Some return to normal glucose regulation, but still carry an increased lifetime risk of developing type 2 diabetes. Some continue to have impaired glucose tolerance or early dysregulation. And some transition into a diagnosis of type 2 diabetes in the years following pregnancy. None of these pathways are failures. They are biological trajectories influenced by genetics, hormones, lifestyle, sleep, stress, and postpartum realities that are often underestimated. Prevention is not a single action, it's a cycle. When we talk about preventing progression to type 2 diabetes, it's easy to reduce it to diet and exercise. But prevention is much broader and far more realistic when we look at it through a long-term lens. It's about regular screening and early detection rather than waiting for symptoms. Understanding your personal risk, not comparing yourself to others. Building sustainable movement that fits into parenting life, not an idealized routine. Supporting sleep where possible, knowing broken sleep itself affects glucose regulation. And importantly, making space for mental load, stress, and emotional well-being. Because chronic stress hormones, especially in a postpartum and early parenting years, can influence insulin resistance just as much as food choices do. Emotional and mental well-being after GDM, there is an emotional layer to gestational diabetes that often goes unspoken. Some women describe feeling like they failed pregnancy, even when they followed every recommendation. Others feel anxiety every time they think about future blood tests or risk of type 2 diabetes. And many feel a lingering pressure to get it right now that they've had that diagnosis. But emotionally, this is also a time to identify shifts. You're not just recovering from pregnancy. You're learning who you are as a parent whilst also carrying new health information about your body. It can help to reframe this experience not as a label, but as information. Information that gives you a chance to act early, gently, and consistently over time. And just as important, you're doing this whilst raising your young family. That matters. Your capacity, energy, and mental space are not infinite resources. And prevention plan has to respect that reality. Growing with your young family. Healthy behaviour after GDM doesn't happen in isolation. it grows with your family. That might look like walking with your baby in the pram instead of structured workouts. Cooking simple, repeatable meals rather than complex meal plans. Sharing movement with your child as they grow. Normalizing health conversations in the household without fear or guilt. This is where prevention becomes less about restriction and more about embedding health into family life in a way that feels natural and sustainable. If diabetes does develop, a collaborative pathway for some people, despite best efforts, type 2 diabetes may still develop. When that happens, the focus shifts from prevention to collaborative management. This is not a step backward. It is a structured care pathway designed to protect long-term health. A collaborative approach usually includes regular GP review and annual cycle of care planning. That includes HbA1c testing to track long-term glucose trends, medication support if needed, introduced early and adjusted over time. So dietetics input tailored to lifestyle, culture, and family routine. Diabetes education to build confidence in daily self-management. And screening for cardiovascular, kidney, and eye health as part of a routine monitoring. The key message here is continuity. Whether you are in prevention mode or management mode, the system works best when your care is proactive, not reactive. So next we're going to discuss the annual cycle of care. The annual cycle of care is essentially a structured health check-in designed to keep everything on track. So for an annual cycle of care diabetes management, it includes HbA1c testing at least yearly or more often if required, blood pressure and cardiovascular risk review, cholesterol and kidney function checks, which is via pathology, foot assessment and nerve health screening, eye review, medication review and goal setting. It is not just paperwork. When used well, it becomes a roadmap for staying ahead of complications and making informed decisions early. And you can complete this with your primary general practitioner and the practice nurse at their clinic. For some final thoughts, after gestational diabetes, the question is not simply, will I get type 2 diabetes? A more useful question is, what supports do I need now to protect my long-term health whilst living fully in this stage of my life? Because this is not just about glucose levels or future risk. It's about building a life where health, family, and emotional well-being can exist together, not in competition. In the next episode, we'll explore how to recognize early signs of insulin resistance and what subtle changes in the body can tell you long before a diagnosis is made. Thanks for listening.